My Lords, I join others in welcoming the Noble Lord the Minister to his new place, and I acknowledge that he has stepped in very late in the piece to pick up this statement. But I think we are asking questions on this statement. Unlike the noble ladies on the front benches, I want to address the issue of doctors, the number thereof and the supply, particularly of GPs. Now, there are some very strong statements here about setting the expectation of getting an appointment within 2 weeks, opening up time for 1 million more appointments, and helping practices improve performance. Now, if you think about what GP practices have done in terms of improving performance, there are now 4.9 million more appointments in December 2021 than there had been 2 years previously, a 20% rise. A BMA survey found that 9 out of 10 doctors reported that their workload was excessive and dangerous. So this statement says there's going to be more GP appointments. Where will these doctors to provide this service in a healthy and safe manner, where are they coming from?
Thank you. As I mentioned previously, we do actually have 3.5 thousand more doctors, but the 50 million more appointments targets, which we are well on the way to delivering, is not just from GPs, it's from across the piece. So it's also from nurses and it's from the community pharmacies. Because I think, as we all agree, the doctors are our most precious resource, and given the comments in terms of not wishing to overburden them and the stresses of that, we need to make sure that their limited time is focused on the most essential patients that need that time. And we are expanding the supply and spreading it amongst the nurses, which, as I mentioned previously, from my experience with my mother, they are very capable and willing to pick up a lot of these, and also the pharmacies as well. So the 50 million increase in appointments is actually not just from GPs, but from across the board, from the nurses and the pharmacies as well.